if you know the heart of the Filipino nurse, the nurse cares for the patient like her own family.
I believe that.
That patient in bed is your father, your grandfather, your cousin, your brother, your sister. We care for that patient as if he were our own. Because nurses to us is not just a profession, it's a calling. Filipino nurses would take the evening or night shifts. They would take the weekends. They would take 2 shifts. Or sometimes they would take 2 to 3 jobs.
Hello and welcome to Asia Forward. I'm Ledy Simarmata and we're coming to you today from New York City. Filipino nurses have been part of the American healthcare system for generations. They've cared for patients, helped hospitals meet staffing needs, and supported their families and communities, both in the U.S. and the Philippines. Our guest today is Madelyn Yu. She has worked as a nurse for more than 45 years and previously served as the president of the Philippine Nurses Association of America, or PNAA. Madelyn is also featured in the HBO documentary, The A-List, 15 Stories from Asian and Pacific Diasporas, which brings together remarkable personal stories about identity, family, and what it means to be Asian or Pacific Islander in America. Thank you so much for coming to Asia Forward.
Thank you for having me. It was fun coming to New York and, of course, navigating through all the traffic. But it's always good to come to New York.
Well, I understand that you've worked as a nurse, you serve as a nurse for more than 4 decades. You've been in America for a long time. So I want to start by, have you telling us about your journey. What brought you to United States of America?
I became a nurse in 1975. And in the 70s, there was a lot of chaos back home in the Philippines and economic turmoil. And we were starting a young family. I was married and I have a son. And looking at everything, I was thinking of how am I or we gonna bring our son up in an environment where it is conducive to raising a child and giving him the right education. So some of my friends were starting to go to the Middle East. The economy then in the Philippines was very unstable.
Right.
There was a lot of unemployment. And the Middle East was starting to have construction going on. So our government started to have programs they called the Labor Code of the Philippines to start having our citizens work outside in the Middle East and bring home some dollars. So it was government sponsored.
Okay. Yeah.
Now, some of my friends who were nurses started to go there also. But I wanted to go to America because the Middle East would be a different culture and it would be an adjustment to another culture. And in the Philippines, U.S. and the Philippines has a long history. The Philippines was under Spain for over 300 years. But after the Spanish-American War of 1898, the Philippines was ceded to America.
I got an article here, a quote from an article published by Time. In 1965, with the passage of INA, Immigration and Nationality Act, that granted migrant nurses the opportunity to petition to stay in the country permanently. This coincided with the growing needs of American healthcare system for nurses. Would that be correct? Yeah.
The migration of the Filipinos started after the war. And the professionals, nurses, started to come in the 50s and 60s through the exchange program. And then the act that you mentioned. It took away the cap that was given to countries for professionals to come to the U.S. So it gave Filipinos a lot of leeway to come to the United States on a working visa. But the United States was still experiencing a lot of nursing shortage. So the answer was to recruit more nurses from the Philippines. Now, Filipinos speak very good English.
Right, yeah, because the English proficiency is there.
Yes,
and
because of our relationship
Yeah.
from the 1800s, the Dalmatian sisters.
Yeah.
Our books were in English. Our curriculum was also based from the American books. So it wasn't a big jump to adjust into the healthcare system of America. So in 1970s, as I mentioned, I was a young mother, But then I was already thinking of how are we gonna, raise our family in an environment where it is conducive for the child or children that we're gonna have to have a better future.
Was it a hard decision for you? How tough was that?
I was a mother, I was a wife, and I was leaving my husband and my son to come to America to work as a nurse. So the separation was just very difficult.
Right.
The homesickness was so difficult. So you come to a country that's foreign to you, foreign healthcare, foreign setting. Yes, we speak English, but the culture is so different.
Absolutely.
So it's a challenge, but in my mind, I was so determined to make sure that as a nurse and as an educated person, as a professional, I will make my mark in America and focus on my dream of bringing my family there. And in the process, hopefully, will bring my family up and provide a better future for us. That was my goal, and I was focusing on it.
So you arrived in Kansas City,
Yes.
if I'm not mistaken.
Of all places, right?
Yeah, exactly. All the way from Manila to Kansas City. I want to ask about culture adjustment.
Culture shock,
in
right?
Kansas City. How was that?
I arrived in November of 1978. I'm a tropical person.
Exactly.
I come from the warmth of Manila, and here
Yeah.
it is. It's winter in Kansas City.
Yeah.
And we're not familiar that you have to have a winter coat. We have jackets, sure, but they were thin jackets. And we needed winter jackets. And I was a small person. I was slimmer than now. And I didn't know my size. My first purchase was a size 14 winter jacket, which
And I assume that's
was
too big.
so
that was
big
too big
for me. So that was one of the fun parts of doing something that we were not familiar with.
Okay, then you went to Kansas City, and then you served as a nurse, and then you continue working as a nurse for 45 years. Can you share with us highlights of your career that you still remember until today that is so meaningful to you and maybe shape you as an individual as well?
I was really focused on my goal to bring my family. Remember, at that time, we were only on a working visa. Then you need to go home. But then the Philippine Nurses Association of America lobbied to create a place for nurses where we can become immigrants, not just working visa, so we can bring our families and reunite the families. So that's one thing that we have to be grateful for PNAA America.
And you became the president, national president of PNAA. So how's the journey, to become elected as a national president?
Let me give you a little history of the PNAA.
Yeah.
Because those chapters that I mentioned, like New York will be turning 100 years old, New Jersey will be turning 50 years old this year, and many other chapter organizations in the country were in existence already. But because of a case that happened in Ann Arbor, Michigan, these 5 chapters got together to form what we now call as PNAA.
Right. Which is the national
organization. Now, during my work experiences, I've noticed that some of our white counterparts were given preferential treatment. We couldn't speak Tagalog, of course, in the workplace because English is the business language, and I understand that, right? But there were little remarks here and there that would make you feel like you truly are a foreigner in this place.
So
you're not.
Were you classified as discrimination at that time?
Correct.
In the workplace?
And there were a lot of cases that we fought for, we meaning the PNAA, for human rights cases and abuses and employer cases that the PNAA has to fight to make sure that the nurse is respected, given her rights, and treated with respect for the professional that she is. So I started to join the PNAA to make sure that we advocate not just for patients, we advocate for patients on a daily basis. I joined the PNAA of New Jersey, and in my role as president of PNAA in New Jersey, we were able to free from detention one of the nurses who had visa issues. We heard about her. and that she was detained for visa issues. We looked into her case. We tried to advocate for her by getting a pro bono attorney from the Migrant Heritage Coalition from Washington, D.C. And we did fundraising to make sure that she was treated all right.
Right.
And she was freed, and she was not guilty of anything, and she now has her life back.
Oh, good.
So that was just one example of how the organization would advocate for a fellow nurse.
Right, right. And we talk about, there's a factor of immigration policy to also enable for Filipino nurses to come to the U.S. and then settle in the U.S. Do you see a connection of the history of Filipino nurses coming to the U.S. to the growing community of Filipino in the country?
Yes, I do.
Yeah.
We have secured our place, so to speak, because we bring with us the caring attitude, the determination, the dedication to what we do. And we come from a community of people who really respect family and our elders. We flourished as nurses. So we made our mark. Out of the 5 million nurses, Filipino nurses comprise of about 4% of the nursing population.
Right.
And we started to make our mark with the healthcare industry by filling up the staffing vacancies.
Yes.
By being in the boardroom now. We have CNOs, we have chief nurses.
And you must feel very, very proud of this.
I am so proud that we have what we call back home bayanihan, which means a group unity, a cultural togetherness. In the setting in the Philippines, if you have one small house in the barrios before and you wanted to move your place to another area, everyone in the community gathered together and lift that house.
Oh.
The whole community helps.
Yeah.
So in the current times, I believe you can see that in that people still help the community across generations and across continents.
Yes. Yeah.
By the remittances that we send back home.
There is a statistics which I find this is striking. This is from Migration Policy Institute. Filipino nurses comprise 27% of all foreign-born registered nurses in the U.S. That's a large number. And I want to talk about something that I find saddening or a bit heavy because you were featured in HBO documentary, and you talk about COVID. Reports shown that almost a third, around 30%, of nurses who died from COVID-19 complications were Filipino.
Yes.
Even though, as you said, Filipino only makes up 4% of the total RN or registered nurses in the U.S.
You are so right.
This is, to me, when I saw this number, there was a tears in my eyes. What factors that created that situation? To me, it's disproportionate
it is
number, right? And I can only imagine maybe because they're more exposed to COVID-19 cases. But, as the president of PNAA during those times, or that time, what happened, Madelyn?
It is such a disproportionate and very unfortunate number, and it was so tragic.
Yes.
So we heard that COVID was coming to America and coming to all parts of the world in the early 2020s, right? It came from somewhere in China, as they said, and that the virus is spreading. But we don't know the extent, right? We don't know that it was so deadly, that it was in the air we breathe. So I was still visiting the other chapters of PNAA America. I was visiting Hawaii. I was visiting Georgia. And then there was the lockdown. The lockdown happened. We couldn't gather anymore. But then nurses are still needed in the hospitals. So you have to guard properly. You have to have your protective equipment from head to toe so you do not breathe in the virus while you take care of the patient. So we started to see people dying. And again, we're in New Jersey. We're near the international airports. We saw the first deaths here in our area. And in 2020, we started to monitor the nurses because they would call me and say, Madelyn, It's my 16th hour and I don't have any relief yet because nurses were getting sick. Nurses were not going to work anymore, but then they were there. As soon as they felt better, they came back. Because if you know the heart of the Filipino nurse, the nurse cares for the patient like her own family.
I believe that.
That patient in bed is your father, your grandfather, your cousin, your brother, your sister. We care for that patient as if he were our own.
I believe
So
that.
if you have a dying patient, you hold that patient's hand, even through the protective equipment, through the gloves, through the mask. You were the last face that the patient sees. The nurse's face is the last face that he sees before he dies. And there was a lot of cases that were like that. We were in the ICUs. We were in the critical care units. We were in ER. We were in OR. We were in the most critical care areas because we like to be there where the action is, so to speak. Our training and our expertise makes us the right clinicians to be there with the patient during their most critical phase. And we do not just leave our patients when they're about to die. We stay. We were the link between them and their families. Sometimes you would hear news that this patient's family FaceTimed because the nurse connected the family with the patient. And some of those patients were cremated before their families see them. So the last picture that they saw was the nurse holding the patient's hand before the patient died. And we tried our best to make sure that the nurses had proper, what we call PPEs, the protective personal equipment, that they have the right gowns, the right masks, the right gloves. They didn't have it. They didn't have enough of it at first, but we made sure that masks were ordered by chapters. We distributed them. We made sure we call the different chapters to check on how many of the nurses are sick, how many died. And it was so disheartening as a president for them to call me to say, oh, this is what's happening here, this is what's happening there. All those things that you and I observed during COVID, right?
Yeah.
But still, too many Filipino nurses died. It was so sad. It was so disheartening. And it was so disproportionate only because we were there where we were most needed.
Wow. That's, to me, my understanding, like, that's what heroes are. That's how we define heroes. Right?
I've known of many, and I've known of many friends that passed. And in fact, I was also personally affected in that my husband died of COVID.
Right.
So one Sunday, he was brought by ambulance to a hospital. The next Sunday, I was brought to the hospital too. So the two of us were in hospitals, and we didn't know whether we would survive or not. And at the same time, I was still the president of the PNAA at that time, and they were praying for me. We're a prayerful group. We believe in God. Most of the Filipinos are Roman Catholics. We have belief that somebody out there really is watching out over us. So we pray for those who were sick, which continues to this day, by the way. They pray for those who are sick, or they pray for those who were gone. But it was such a very difficult time.
Absolutely.
And in the end, we knew that about 1 million Americans died because of that pandemic.
In the same article that I read, published by Time, it says that since the 1960s, the U.S. medical system has had a historical pattern, quote unquote, of turning to Filipino nurses to work at understaffed hospitals, particularly during health crises. Is that still going on till today?
The United States administrators go to the Philippines when there's understaffing. During the height of AIDS in the 80s, late
1980s.
70s, they were going to the Philippines to recruit in hospitals. They would go to hotels and advertise that we're this hospital and that hospital, and we need this so many nurses, and this is our state. We can give you this kind of salary, and you can improve your life, and this and that. But then they would assign the nurses which were truly capable and qualified to work in those critical care areas. So people can choose where they work, but sometimes those they recruited would be placed in an area where nobody else would choose. So Filipino nurses would take the evening or night shifts. They would take the weekends. They would take 2 shifts. Or sometimes they would take 2 to 3 jobs.
Right.
Just to make sure they have enough money to send home to support not just their own nuclear family, but to support the families back home. Remember, we're a community-oriented people in that we care for grandparents, nieces, nephews, grandchildren. We care for our extended family as a community.
Yeah, it is deep in our culture
It's
as well.
in our culture, correct.
Yeah. I want to ask you something maybe a bit personal. What does it mean to you being a nurse?
It means you care for an individual or group of individuals or the community from birth to death, promoting their health, not just waiting for them to get sick, promoting their health, keeping them healthy. And when they get sick, you have the science and the knowledge and the clinical expertise of taking care of them when they are infirm, when they are in the hospital, when they do need your critical thinking, when they do need your emotional support. Because nurses to us is not just a profession, it's a calling. It's a calling. Your heart has to be in it to survive being a nurse because it's a very difficult job.
Yes, it is. It is. Now, if you do a little bit of an evaluation or reflection, from these numbers that we discussed, the disproportionate nurse deaths during COVID and other health crises, not just COVID, what will be your suggestion to, current healthcare system, the U.S. healthcare system, in terms of managing the shortages of nurses?
The U.S. recruits from all over the world.
Yeah.
I know they're recruiting from all parts of the world, but they like going to the Philippines because of the education that we have, the English proficiency, and the kind of nurses that they get. Really determined, really caring people. So it should be an investment now in the educational system in the Philippines. I would like to see the day that the U.S. would also look at the infrastructure back in the Philippines and say, since we are getting from them, maybe we should help the infrastructure back home. Let's help them with their professors. Let's support the educators in the Philippines. Let's do some exchange education. Let's have some exchange student. Let's support them by doing some simulation labs in the Philippines. Let's support their equipment and supply. Since we know we're going to get more nurses from the Philippines, and since we like the products of human resources that we get from the Philippines, let's support them. It should be more of a brain gain if we do that. Not just draining the country where you're getting it from. And it's usually the richer country getting from the poorer country, in that it's leaving the poorer country with the brain drain that we described. So it should be viewed more as a partnership.
Absolutely. Well, folks, please subscribe to our channel to see more full episodes of Asia Forward. We're going to continue this conversation, Madelyn. You mentioned about remittances. Now I want to talk about the economic impact of the existence of a large number of Filipino nurses in America.
Correct.
It's been known that remittances is one of the main elements of the Philippines GDP. I have a number here. You can correct me if I'm wrong. So the remittances from Filipino nurses contribute roughly $8 billion US dollars annually to the economy of the Philippines, which is 25% of all remittances. So that $8 billion US dollars is about 2% of the GDP of the Philippines. The GDP of the Philippines is about $480 billion US dollars. So that is not small. What's your view on that?
Well, the government of the Philippines started to send Filipinos to many countries, first to answer the need of the Middle East in the construction. So you have the engineers and nurses going to the Middle East. But now some of the countries they prefer to go, of course, is the USA. Some would go to Germany. Now the Filipinos are all over the place. And we do send remittances back home. Again, it's coming from a place we call utang na loob in Filipino, meaning to say the debt of gratitude. If somebody was good to me and cared for me, I tend to give back.
Right.
I would tend to give back to my grandparents who raised me and sent me to school. And we do send remittances. Again, in the HBO documentary that you mentioned, I stated there that I would send half of my salary back home.
Wow.
Because my family was still there. Yeah. I was only earning $7.50 at that time, but half of it would go to my family and half of it would support me here in America. So now that we've stayed many years here now, it's been more than my adult life that I've been in America. I'm a U.S. citizen like most of the Filipino nurses here. We have helped the U.S. economy by paying our taxes, by buying our own homes, by having businesses. Some are nurse entrepreneurs with businesses. And we also help the economy back in the Philippines. And you mentioned the remittances that not just the nurses, what we call the OFWs or Office of Fellow Filipinos who work abroad. They send a total of, I would say, $35 billion in 2025, which amounts to 7 or 8% of the GDP of the Philippines. So you have a breakdown of how much the nurses send. We send a lot of money.
Well, it's not a small number.
It's not a small number. It's a huge help that the nurses and other foreign workers, Filipinos who work in foreign countries, send back to our native land. Again, with the idea of helping the community. And in so doing, is helping the Philippine economy.
Yeah. Do you ever see that as I find it, very unique in a very, good way that, especially when it comes to Filipino nurses in the United States, you become an integral part of our lives, the Filipino nurses. Whenever I go to health facility here, I will see Filipino nurse right away, right? You are part of our lives. You contribute to the economy of the United States. But at the same time, you're also contributing to the growth of the economy of your home.
Correct.
In the Philippines at the same time.
I believe that is one of our very good traits as Filipinos. We're family-oriented, we're community-oriented. I've helped some of my siblings and a lot of my nieces and nephews because I know they couldn't afford it. They couldn't afford to send their children to school. So let me help. So right now, I'm on child number 15, sending him to school.
Wow.
His second year in college.
Senator Tammy Duckworth, who also appeared in the HBO documentary, she suggested the idea or raised the idea of Americans studying nursing in the Philippines. So this is to tackle, again, problem with nurse shortages in the United States. So I just want to know, what's your view on that idea?
I studied from the University of the Philippines, which is the state university, and from all sources is the best school back home.
Of course.
So I've seen foreigners in our university. I've seen people who study medicine. I've seen people who study veterinary medicine and other courses, not just in the University of the Philippines, but in very many really great universities in Manila also. So it is an economically wise decision to do that because right now the Philippine peso is 61 pesos to $1.
All right.
So if you have $100, you now have 6,100 pesos. It goes a longer way when you spend it in the Philippines. So tuition is, of course, then cheaper, but the education you get is great. We have great educational system back home. There are many examples already of successful people who finished their medicine in in the Philippines and in other countries. But again, it's economically a very sound proposition.
So this can be actually pretty good partnership.
The idea is very good. We just need the support of both governments
Yep.
to see it as a partnership
Yep.
and not just one country looking at another and say, okay, we'll get a resource from there. They have to support the resource so the pipeline won't dry up.
Yeah. Healthcare services is, again, integral part of our lives. There's a saying, I've been hearing people saying, without Filipino nurses, American healthcare system will collapse.
Probably. At this time, probably.
Right? Should we say that we should encourage longer or future, longer partnership in the future between the United States and the Philippines, between nursing school or between hospitals in the two countries?
In fact, if we look at it more, it should be global, not just
Right.
U.S. and the Philippines.
Yeah.
It should be a global outlook into the healthcare of all the citizens of the world, since the U.S. gets its nurses and healthcare personnel from all over. The big bulk, of course, coming from the Philippines. So they should really look at it as a partnership. Remember, we're all growing old.
Yeah, American is some say aging society. We have a growing percentage of older adults, so we say 65 plus, right?
I'm one of those. And
The 65
seniors?
plus, I think it's about 17-18% right now.
18%,
Yeah.
okay, probably.
And predicted to increase.
So we will have more geriatric population that would be needing care because now as you grow older, you have chronic diseases, hypertension, diabetes, your memory fails, your body gets weakened. So you would need not just the hospital setting, but aging in places
Right.
or the home care settings or Alzheimer's centers or dementia centers. And nurses are a huge part of that. Nurses are not just in the bedside, they're also entrepreneurs. I do have friends who are nurse entrepreneurs and they have home cares. They have living facilities that cater for people with Alzheimer's, that cater for people with dementia. This should be supported as we all age. We are lucky if we turn into 70s or 80s or more and still have our mental faculties intact and all our arms and legs are moving and we
Yes.
still enjoy life
Yeah.
as we should.
Yeah.
So we do need the help of healthcare personnel,
Yes.
not just nurses, doctors, nurses, rehab people, physical therapists, everybody, dietitians, to make sure to direct us into the correct health. To make our lives having that optimum health so we can enjoy our senior years.
Yes, yeah. You mentioned about nurses then moving up to leaderships and also becoming entrepreneurs. So do you see that this, I would say, progression will be more in the future? That particularly among Filipino nurses?
I believe so. From the start, even when we were little, the importance of education has been drilled into us. My grandparents who raised me says, your chance in life is, of course, improved when you have education. What your knowledge that you gain from education, nobody can steal from you. You can lose $1 million, but not the knowledge that
Yes.
you have gained. So people really strive for education and postgraduate education. So now we have nurses who are educators, who are administrators, chief nurses, professors, which I'm really happy to look at because you are in that place now where you can improve your lives, not just start. And there's no shame in being at the bedside and be the best clinician. There's no shame in that. You're the best expert clinician. That's so wonderful. But if you want to go to other avenues, like to teach in colleges, because even the U.S. is needing more educators for nursing. We have less professors, so that's why the enrollment for nurses is very small because we need professors.
Yeah. Now, this is my last question.
Sure.
We always ask this to our guest. A question that we called Asia forward thinking question. So if you're looking into 10 years from now, 5-10 years from now, how do you see it becoming the role of the Filipino nurses in American healthcare system?
I hope we would still be agents of change all over the world, not just the U.S. We have proven our worth in the USA. And we are in many parts of the world. We are in Germany. We're in the United Kingdom. My sister works in Ireland. My other sister works in Dubai. They're in Australia. They're in Japan. They're in Hong Kong, Singapore, all over the places. So we would like to see a time when it will just be an ordinary thing and not say, oh, she's Filipino. No, she's a nurse. She's a professional. She's an expert in healthcare, and she will make your life a lot better.
I know I said it's my last question, but this is really last now. What would you say to Filipino nurses in America today who, as you described, and as I have also learned from our conversation, they work really hard. They have personal reasons, professional reasons, so both, right? What will be your message to them, Madelyn?
Thank you, nurses. Thank you for what you do. Thank you for caring for me, for your family, and thank you for caring for the world.
Oh, wow. Thank you so much, Madelyn. Thank you so much. We at Asia Forward also want to thank you.
Likewise. And thank you again, Ledy, for shining the light on Filipino nurses and for nurses in general. Thank you so much.
It's our pleasure. It's our honor. And thank you to everyone for tuning in. You can find more episodes of Asia Forward Podcast on YouTube, Spotify, Apple Podcast, or wherever you get your podcast from. Follow us on LinkedIn, Instagram, and TikTok, and check out our website, asiaforward.org. I'm Ledy Simarmata. I'll see you next time.